Yeah, sometimes you hear about people, taking on that new role and learning new things about themselves. Do people talk about those kind of experiences at all?
Oh yeah. And it's not like we talk about like positive aspects of caregiving, and
Mhm.
obviously it's not mutually exclusive. It's not like you either have a positive experience or a negative experience. A lot of times people will experience stress and at the same time, like you said, learn about themselves, learn about the relationship. Sometimes it can be something that mends a relationship. Um, I once had a client who had a really strained relationship with her parents who she was caring for. And even though she was really stressed and it was impacting her other relationships, and she was really struggling with taking on the caregiving role. And she felt like personally, it was just something that was so important to her to be able to, provide this and to say, this is how, like, we had a strained relationship, and now I'm able to kind of repay back the things that I appreciated about the relationship, even though it does cause me stress. And so I think caregiving takes on so many different meanings for people, and there really are infinite possibilities to learn about yourself and to learn about relationships in general. And also, people think a lot about their life and their existence, and so it can be really transformative in a positive way for people as well.
Yeah, it's interesting because, you have this long history with a person when you're a caregiver, and, things have probably changed in your relationship, and maybe that person's not cognitively able to be the person that you knew before. So you're kind of going back and forth between the previous self and the new normal. I wonder how people kind of negotiate the now from the before.
I think that's one of the biggest struggles that I see. And again, I think to one of your earlier points, I'm seeing people who are, struggling emotionally. They're, having a challenging time. So I say this not as like a general rule of caregiving. But I think when people do struggle and it really impacts their mental health, a lot of times, when we dig into that, there's some rigidity in how people are defining those roles. And it's based off of that long history. If you're a spouse, you develop a script for what it means to be a spouse. And then as the context changes, that script no longer fits. And I think that's really challenging to be flexible and to say, as this person changes, as our relationship dynamic changes over the course of this illness, um, it doesn't really fit with how I've evaluated the good spouse or my role as a spouse. Um, and because there's so much history, and because there's grief on top of that of losing the role, it's really tough for people to be flexible with that. And I think a lot of times it's that holding on to, this is how I must act as a spouse, that causes a lot of challenges for people, because they're kind of setting themselves up for failure, because the context doesn't really call for the same script and evaluation of that.
I love that you're talking about the kind of reevaluation of the role or the script. I had a friend who was taking care of her husband who deteriorated with his function because of dementia pretty fast. And she said she felt like it was her second marriage. So she wasn't viewing him as, the first husband that she knew for a long time. She really was coming to him with love as a second husband, which was probably really important for her, and, thinking about how to interact with her husband while he really could no longer communicate with her like he once did.
That's so important. Sometimes with clients, I'll kind of help people create a new name. When I think when it's hard to flexibly kind of change like the name of spouse or caregiver, um, and we talk about evaluating yourself as a good caregiver as well. And I think a lot of the standards that people who maybe are struggling with that role, bring are based off of like professional standards. And I tell people, I'm like, you're not a nurse. Like, you don't get to clock out. You don't get paid for this. Like, it's a really
Yeah.
that's a bad job. Like,
Yeah.
also, if you were a nurse and your spouse came in, they probably wouldn't let you care for them because that's a conflict of interest. So, like, how do we kind of abandon that script? And also, like we talked about with the spouse, that changes as well. And sometimes just coming up with a new name for it, to say, I'm the partner, I'm the caring presence. And then now we define what that means and what my expectations are in that role. And so I think changing the language for people that are really stuck can be so important.
Yeah, I also see like parallels in any kind of caring role in our society. Being a mother, am I a good mother? Am I a good parent? It feels like a lot of responsibility, especially if you love someone. So it's just hard. So it's just, having a lot of support from people like you, I'm sure is really helpful. But I also wanted to ask about some of the recent research that you've done. I know you recently tested an intervention looking at group psychotherapy for caregivers. Can you tell me more about that work that you did?
Yeah, so this was actually a project that a couple colleagues and I put together during the pandemic. So we were noticing that it was really hard to get connected with mental health services during the pandemic. And we didn't see so many new stressors amongst caregivers, but kind of exacerbations of things that were already, stressful, with removal of social supports, removal of sometimes respite care. And so we developed a group. So we kind of picked and choose what we knew worked with caregivers as far as skills for depression, anxiety, and emotional burden. And so we kind of put together a group format based off of those evidence-based skills. And it was elements of caregiver family therapy and cognitive behavioral therapy, as well as communication skills and self-compassion skills. And so we rolled it out in an 8-week group. And we actually found that folks improved in their burden, caregiver burden, which I don't love as an outcome. And I think also this, like, linguistically, it feels like that's not really what we're talking about. Because when I think of burden, I think of like annoyance. But
Yeah.
we're not really talking about annoyance. We're talking about kind of impact on your life. But we did see people improve in burden and also in self-efficacy. So folks felt like they were better caregivers at the end of the group, and also better able to regulate their emotions in the caregiving role. And anecdotally, just it was a little bit different, because I think a lot of times groups around caregiving will be support groups where it's kind of like open forum and people will discuss, and that can be really beneficial. And this was really focused on skills building, so it almost felt like a class where
Mhm.
folks would come in and we would teach a skill around whether it's problem solving, managing symptoms, or managing difficult emotions. And then people would practice that, and we would talk about it the next week.
Yeah, support groups are helpful, but it's really important to have those skills built into that support. So I think just having psychotherapy as a potent thing that we can take from clinical psychology research and adapt it for that format is probably pretty useful.
Definitely. And I think also, based off of just having a high need to see folks and not a lot of providers, having those skills-based groups can be more time limited. We can get people in and, get, them engaged and be able to see a lot more people. So I think it was also beneficial in that regard. But I think having that mix of people really like the support aspect of it, of, oh, here are other people I'm going through what I'm going through. And sometimes it can feel isolating And just to know that there are other people who even just sometimes have these emotions. I think even in the individual therapy, like naming an emotion and like me not looking shocked when somebody says like I'm angry or I'm relieved that something happened, and I mean like, yeah, that makes sense. They're like, oh, thank God, because I feel like I can't tell anyone because so I think that can be really therapeutic for people as well.
Yeah, and I feel like on the side of the clinicians too, it's more effective, right? Because you're giving the same information to people over and over again. And like, why don't you just tell them in a group format and then have other people kind of check on each other to see if they're doing what they're listening to from the clinician. So, like in prenatal care, where you go in with groups more often these days, and then people kind of form these friendships with each other and make sure they're doing the healthcare behaviors for a good pregnancy. It seems like that would also work for caregivers going through things together.
Totally. Yeah. And the group that I ran in that project, at the end, everyone asked if they could like exchange email addresses and keep in touch. And so it was really nice to see.
Yeah, I think it's almost like a little similar to mindfulness-based stress reduction programs where you're kind of getting all these new ways to talk about your emotions with other people. And then when I did it, what was cool is you had different people from all walks of life, and they weren't just like me. So seeing like a 60-year-old lawyer guy who's like having anger issues and hearing what his emotions felt like in his body. And it just gives you a greater awareness of humanity and how we all experience emotions in the same ways, but also differently. It seems like also having this context, like a series of stressors that everybody has in common in these caregiving groups, that might give you that sense as well.
Yeah, and I actually hadn't made that connection. It sounds very like self-compassion of like recognizing the human experience. Um,
Yeah. So I'm going to change gears here, but I also wanted to learn, about some of the research that you're working on right now. Could you tell me about the studies that are up and coming?
Yeah, so we actually have two studies here at Mass General that we're recruiting for. So we have an intervention designed to help stress reduction amongst caregivers, and it's completely app-based. So we're casting kind of a national net for recruitment, so people don't have to come to Boston. We can do everything remotely. We just download an app on somebody's smartphone and they can participate. And the program again is designed to help with stress reduction, specifically for caregivers of folks living with Alzheimer's and related dementias. And then there's another study that we're looking to interview couples who are experiencing Alzheimer's disease and related dementia. So somebody with a diagnosis and their care partner. And we're trying to develop a technology that can go in the home that can really engage the couple together. And so we're looking for people to participate in focus groups for that to kind of help guide that research. And I can, if it's okay, I can give you information on that to put links to how, if people are interested in sharing that opportunity, how they could do that.
Yeah, that's great. Along with this, I'll post the information about how you get signed up for your research and see if they're eligible for it. So, if you had to give a caregiver who's experiencing depression or anxiety or guilt, some basic advice to get started, what would you say?
Yeah, I mean, I think we touched on a lot of like really important topics. And I think for me, kind of like the number one thing that I see that leads to some of those things like depression, anxiety, um, is issues around that flexibility, like being really flexible in the evaluation of yourself, the way that you define your role. And again, those expectations that you place on yourself as a caregiver. Um, I think having that flexibility is so important because, I mean, this is an illness too, when we talk about dementia, that changes. Um, and can change fairly rapidly over the course and can throw you a lot of curveballs. And so I think that's one of the skills actually that a lot of caregivers develop is flexibility, as far as problem solving, as far as providing care. People are usually very creative. People are usually very flexible. You kind of have to be. You're forced into it when you're dealing with dementia. Um, and sometimes people don't always apply that same framework to their own mental health and emotions. And so I think flexibility around there are a range of emotions that come up. And sometimes it's anger, and sometimes it's guilt, and sometimes you have a good day and a bad day, and that's okay. Um, the way if something's not working, it may not be your fault. It can be that maybe you just need to redefine how you're approaching care, or maybe you need to bring in some help. So I think just really being flexible in all areas of the caregiving journey is just so important, and also really hard to do because, as you said, it's rooted in love, and that sometimes flexibility in love can be like challenging for people because they want to do such a good job. They want to care. Um, so but maintaining that flexibility, I think, is so important.
Yeah, I just love that idea of kind of saying, be flexible, self-compassionate, and self-aware. So, yeah, thank you so much for talking with me today, and this is so great.
Thank you so much for having me. I really appreciate this platform. And again, thanks for all that you're doing for aging families. And it's really great to see you and speak with you.
Yeah, you too. Thanks for your work, Evan. All right, bye-bye.